Hello, I'm Dr. Qureshi, and here we are with Q&A with Dr. Q. Heartworm disease is a mosquito-borne illness in dogs, cats, and ferrets mostly, but it can be in other wild animal species as well. It's very prevalent in warm climate areas, and also you see that mostly in spring and the summer. The mosquito has to take blood from an infected animal and bite a healthy animal to inject that infected blood into that pet or an animal, and then that goes to under the skin, get absorbed in the system, go to the blood. And actually these are small little parasites or worms who live in the blood, on the bloodstream, and they can settle down on the right side of the heart, and they grow into larger worm and produce further smaller worm. What it does to the dog is they can get lung disease, they can get heart disease, they can get really sick with it, and they die. So it is a serious condition for dogs and cats and ferrets, so it should not be taken in lightly. It is here in Canada, in Southwest, very prevalent condition and life-threatening condition, so it should be taken seriously. When you go for your annual visit with your veterinarian once a year, usually they recommend testing for it, and usually there is a simple blood test they can take, and they test for an antigen of an adult heartworm, which is already, if the dog is infected, that's already in their system, and there's an antigen or chemical release from that female heartworm. You can test for it. Or also sometimes you can test for those baby heartworms which live in the bloodstream. You can test for that too. A lot of the time people go to their veterinarians and they've been tested for heartworm, and they say, oh, your pet is negative. It means a good thing. You know, whenever we get negative test, it doesn't mean you have wasted your money, and so it's a good thing. You should be thank your veterinarian that your pet is negative for heartworm disease. So now you don't want to see that your dog is positive for it, because positive means your pet already has a disease, and that's a bad news. It can be treated, but it's a lot more expensive, a lot more life-threatening. So prevention is the key. So testing is the key to have it done, and you want to see a negative test for it. Prevention nowadays there's a lot of advancement in prevention of heartworm disease in dogs and cats. So prevention can be done. There are a lot of medications available you can get from your veterinarian. It can be in a pill form, which pets take once a month for 6 months. In Canada, the prevention is 6 months a year. But now, due to global warming and everything, the summer season is extending. So I have seen over 30 years of my practice that usually used it from June 1st to November 1st in Ontario when the weather is warmer. But now we start preventing them almost 9 months. So in April, when the weather gets milder, and it stays till October, November, when the mosquitoes can be still around. So you want to prevent from 6 to 9 months a year. In US, where there are warmer climates, they do throughout the year, 12 months a year. So prevention, pet can take tablets once a month. It prevents, but usually they're combined with other conditions like other parasites and all that. So you not only want to prevent heartworm disease, but also you want to prevent other parasites. And there's a combination tablet you can get. Also, it can be a topical treatment, which you can get a tube you can apply in the back of the neck or the back of the fur, and that can get absorbed in the system. So there are many options. They're very safe, they're very economical, and this is the way to go to prevent this condition. So don't look for when your pet gets sick and they already have a condition. You want to prevent it, and prevention is the key.